So we went to Raglan Road Clinic, and what we saw there is that when one comes to the clinic, they first meet the receptionist nurse, where they give their details and they're given a file. Their details are put into a system. So their first point of contact is the receptionist nurse, where they are given a file with their details and everything in it. So from the receptionist area, they go to the waiting room, but also in the waiting room, the waiting order is where they prioritize the sick and the elderly. So first priority goes to those who are really sick and those who are elderly. And then in the waiting area, the maximum time of waiting is 3 hours. So from the waiting area, they go to the allocated consultation rooms. And in the Raglan Road Clinic, there are, I think there are 3 or 4 rooms, where there's the chronic illness room, where's the children's room, where there's the TB and HIV and all the other diseases room. So where one, according to their sickness, they are allocated a room or a nurse which they should go to. So in the consultation room, what happens is the nurse checks the patient's history file, and then they check their physical and emotional behavior, and then they check their vital signs like their heart rate. After checking all those, they check what the person is here for, and then they are given a description of what they should get from the dispensary. So right from the nurse in the consultation room, they go to the dispensary room where they will get their medicine and leave.
If you're unable to make it to the clinic, every 2 to 3 months, there's a group of people, nurses, that go to your house to draw blood, to check on you, to check on your vitals and everything. So then they give you the medicine that makes sure that they're taken care of like that. They have treatment for chronic diseases and illnesses. So that means that the patients who are labeled as chronic patients do not have to come and wait for their medication. They just come in and it's already packed up for them, and then they get it and they leave. They have treatments for mentally ill patients, but they do not really engage in that because they're just nurses. You know, there's only 4 nurses in the whole clinic. So from that, they refer the patients to Settlers Day Clinic, and then it's very difficult for them to follow up on that, but those are the treatments that are provided.
When you visit the Rhodes Clinic, there are 2 waiting rooms. One is specifically for mother and child, and one is for everyone else. The reason there's a specific one for mother and children is because children have a sensitive immune system, and also the reason is the mother is also included is because their immune system is weak, as is the child. After the waiting room, you register with the data capturer and the receptionist. And at Rhodes Clinic, there's only 1 data capturer and 1 receptionist, and we were told there needs to be 2, but because of shortage of staff, they only have 1. And then from there are different departments where there are different professional nurses. So there's a professional nurse for chronic services, and that is illnesses that have something to do with pills or treatment. So that would be asthma, epilepsy, HIV, etc. And then there is a professional nurse for minor ailments, so things like flu. And then there's a division for allied services, which would be doctors, dietitians, physio, and dentists. And there's a timetable as to when these allied services come. So doctors are there for referral. So when, for example, the chronic services has, like, they draw blood, test the blood, and they can't give out like medication without the doctor. So the patient is referred to a doctor, and then the doctor writes down prescriptions and what the problem is. Another section of the clinic is a specific section for TB. So there's a nurse for that as well. So that's a total of 3 professional nurses. And then there is a professional nurse, which is basically the manager of the site, which deals with admin. But because there's a shortage of staff, again, the manager has to help wherever she can.
So we went to Middle Terrace on Thursday, and the first point of contact is the reception area. And if you cannot make your appointment in the reception area, you are allowed to book an appointment through the phone or to come the previous day before having your appointment. And usually after you make your appointment, you go to the sisters or also the nurses, and they do a general health checkup. So they check your heart rate, your weight, your BMI, and your blood pressure. And each staff that is in Middle Terrace is trained to do first aid and everything else, such as when there's emergencies. The chronic patients come once a month, and that's for checkups, which for administration reasons, it's overseen by 2 people. And the nurses in training usually do HIV tests and sometimes TB tests on the patients. There's a psychologist who comes in every Wednesday, and usually before you go to the psychologist, you're referred to by a nurse. Or if you're a student from Rhodes, they refer you from the SAN to Middle Terrace. And if it's something more severe, you're referred to Fort England. For the outreach programs, the programs for the community, especially for those and low-income families, there is a community provider and a healthcare worker who goes door to door to require treatment for people in the community who've defaulted or are currently on treatment or do not believe in treatment, and so the healthcare provider goes to speak to them. Usually through the referral system, the nurses from Middle Terrace refer people to Settlers Hospital, and that is through the ambulance system. So they make a call to Settlers, and an ambulance comes to pick up the patient if it's something too severe for the nurses to handle.
Looking at treatment, they have challenges of not having a psychologist, though even though they give patients psychological treatment, doctors come once or twice a week. Also, if for an example, if there are cases that they cannot deal with, they refer the patients to Settlers Day Clinic or hospital, and it happened. The process happens in the sense that the patient is given a date of when to go to the clinic, and then a doctor will be at that clinic at that time or something like that. But that's how the referral process goes.
But it's very difficult. One of the challenges for the patients is that transportation. It's very far. They sometimes have difficulty getting to Settlers Day because they don't have transportation, and that means that they can't follow up on their referral, and then they just keep on going back to the clinic because you can't just go. You need an appointment to go, so it's very difficult for them to deal with that.
Also, other challenges of the waiting period that patients wait. So the clinic has a problem of staff shortages. So there's a much longer waiting period than there has to be because there are few nurses in the clinic, and even those few nurses have to deal with everything. For an example, when we went there was a nurse who is not really qualified to be in the children's section, but because there is no one there, she had to fill in so that also that department, that side of the clinic flows. So the fact that there is shortage of staff is an issue with the patients because they have to wait longer.
They're quite a small clinic, so they tend to be under-resourced. They have issues sometimes getting enough medication to people, and there's also very long waiting times. It's plus minus 3 hours, the waiting time. So what they've tried to do to combat that is to get people to make appointments. So they have an appointment system where you can book over the phone,
and that way they can plan how much medication they might need if people tell them what they might be coming for, and you also get less people in the waiting rooms at a time. They also have adherence clubs, so chronic patients that need medication over long periods of time. They would be in a club of about 10 to 15 people who live in the same area, and then one person from that club will come in when they need medication and distribute out in the community so that they don't have to be waiting for medication when people are waiting for treatment. There's also CCMDDs, so that's a program where the clinics work with pharmacies in the area so that people can get medication at another pharmacy like a Clicks or something like that, so that you get less people in the clinic at a time when they can be looking after people that need treatment, and that reduces the amount of people that are sitting in there and making each other sick at a time.
One of the challenges that they face is that there isn't a generator, and they showed us a room where they keep their medication, and also there's a refrigerator with the insulin. And because there isn't a generator, that now means there's a problem because there isn't anywhere to store the insulin. And also, when it comes to there being no generator, that means when a person goes there for the first time to register, the data capturer cannot capture that person into the system, which now causes problems because they use the data to trace who needs to be here. Another challenge is that some people don't follow through with the medication that they're given. So they have programs where they have people that help them as the clinic. So like private organizations that help them with people that don't follow through with their medication. And also when it comes to TB, there are extreme types of TB, so which would be multiple drug resistant and extreme drug resistant. And the problem with that, maybe when a person reaches extreme drug resistance, they may not be able to, they may be bedridden, which means they can't come to the clinic. So also that becomes a challenge for them, and that's also where they work in conjunction with other outreach programs.